Hello, my name is Stephen Thomas, nephrology nurse practitioner, owner of Kidney Connect. This is Module 4, Renal Diet for Dialysis Patients. This module is geared towards empowering the nurse to know and understand the necessity for the renal diet within the dialysis population. It is not a diet that is regularly followed due to its restrictive nature. Objectives. By going through this module, the nurse will know what the renal diet is, know why it is vital for the dialysis population, know the harms that come by in inadherence, and be able to empower dialysis patients to understand and follow the renal diet. Here's all the content that we'll be going over today. A review of the renal diet, goals, nutritional care for hemodialysis patients. We'll get into the electrolytes of sodium, potassium, calcium, phosphate, talk about fluid, protein, and amino acids. We'll go into culture in regards to the diet and the dialysis population, health literacy and educational strategies, and trans-theoretical change model. The renal diet overview. The renal diet as a whole is a fairly restrictive diet that is focused around specific electrolytes, such as sodium, potassium, phosphorus, and calcium. The goal of the diet is to keep homeostasis within the dialysis patient. The diet helps keep these electrolytes and also protein and fluid, keep them within check. At any point in time where these electrolytes and the fluid and protein are either too much or too little, we can definitely see some adverse events occur. This is maintained by restricting and allowing certain foods and beverages for the patient to consume. The diet is mostly the same for everybody, but there are a few exceptions where certain liberations are allowed. This is usually seen where deficits in labs can occur, such as for malnutrition, if a patient happens to have any native kidney function, and also through pharmacology. The importance of the diet is to keep the patient safe from events that might happen due to renal failure. For instance, the diet and keeping homeostasis, we are preventing myocardial infarctions, cardiac arrest, stroke, failure to receive transplant, and amputations. Within a myocardial infarction, the typical one is where you would generally see like fat plaques build up within the arteries. The same thing can happen if a patient happens to have too much calcium in their diet, but instead of like fat deposits, it's actual like calcium deposits, which is like hard like bone. And so that can cause an infarction where you have a heart attack, right? And so, and with that, you would have to have a bypass. There's no stenting that takes place at all. With cardiac arrest, if a patient happens to have too much potassium in their diet, it can throw their heart into a pretty dangerous rhythm. Stroke, the same thing can happen where you might have calcium deposits built up within the arteries near the brain or around the brain. Failure to receive the transplant, there have been instances and occasions where a patient has been on an operating table ready to receive a kidney, and they had to sew them back up because the arteries and the veins were calcified due to their inadherence to stay with the renal diet. And as well as amputations, whether it be in regards to uncontrolled diabetes, or like I was talking about before, within the calcium deposits, where arteries and veins are occluded, or where they're unable to, there's no blood supply going to the lower extremities, there's definitely amputations that can occur within our dialysis population if they're not adhering to the diet. The optimal way in teaching these patients about the renal diet is to focus on the foods that the patient can have. This will promote positivity within the interaction, and it is also empowering for the patient to see what is available to them. Not only is it good for them to see what they can have, they also have to know the reason why. Educating them on the why is vital to bring meaning to what they are doing. Not being educated on the diet is one of the major barriers for not following the diet. Some barriers to adhering to the renal diet is finances. As we all know from the previous modules, the combined median household for people who have chronic kidney disease, especially in the South, is roughly around $50,000 a year. So when you're taking in, for instance, rent, bills, whether that be like electricity, water, gas, cell phone, car payments and whatnot, they usually skip out on the diet, like buying produce, fresh produce from the store, or anything of that nature. Fast food is definitely one of those things where it's cheap and it's easy to get, and it doesn't take much thought process to get. Another barrier that happens is there's no family support. Most of our aging population, like the 60 and older, live with live with their families. And if the family is not on board with the renal diet, then the patient won't be either. Usually the patient eats what the family eats, and what the family eats is what they would normally eat because they have normal kidneys and not so much a restrictive diet where they would set aside something for the patient to have. Also, there might have not had any previous coaching. Our patients do crash and burn on dialysis into the hospital, and they haven't had any type of formal education on what the dialysis diet is. Also, a misunderstanding, some things can be mixed up, what they can and what they cannot have. Usually, sometimes our dialysis patients tend to forget, or they might have heard us say something when we didn't, especially when we're using masks in the dialysis center. The the communication component is very vital when we're talking to them with something that's covering over our ability to speak. Another barrier is they are focused on only the restrictions. Oh my gosh, I cannot have this, I cannot have that. And so when we're facing with a bunch of negativity, and especially within our mindset, it can be very defeating. So as I said before, it's very beneficial to focus on the things that they absolutely can have to overcome this barrier. Not feeling involved is another barrier that can lead to a barrier to adherence, where the patient feels like they have no say, they have no voice. We all know that the patient is the center of the care plan team, and if you don't involve them, they're not going to do it. Cultural norms are a huge instance within the dialysis diet or the renal diet, especially when we're talking about restricting certain staples within their foods. We want to be very sensitive to what it is that we're saying and fine tuning it to the patient's needs, regardless of what their background or ethnicity may be. Limited options that are available, they might feel that it's too limited. Some habits are really hard to break. It does take time to cook the food or to go shopping for the right food. Social events can definitely be a barrier, especially with birthday parties or weddings or whatnot, because the wedding or the birthday party isn't so focused on renal diet or kidney friendly diet. It is based off of what the majority is. And so for these patients, it's always good to explain to them, yes, you'll go to social events like that. That's not a problem. That's not an issue, but be mindful for what it is that you're eating. I'm not going to tell them you can't eat anything there, but I will tell them, make sure you are keeping in mind what it is that you are consuming. Because far too many times I have had patients go to weddings or go to birthday parties and come back severely overfluid or having having hyperkalemia, elevated potassium. And like with what we're going on through right now, like we all tend to stress eat, right? It's an unfortunate occurrence that happens, but it happens to the best of us. And our patients are no different than the rest of us when it comes to eating or stress eating. Especially when we're stressed, what do? We don't think about what it is that we're eating, and we eat until we feel good. That definitely happens within our population. And willpower. It takes a lot of willpower to say no. It takes a lot of willpower to say, okay, I can only have this, or I can only do this. This is the list of foods that I can absolutely have. So some patients, if they are on board and if they've been educated previously, have tremendous willpower and take into accordance and be accountable for their diet so that they can stay around long enough to receive a kidney transplant or not get turned away because their labs are showing that they aren't stable enough to receive one. So the goals overall within the kidney diet is to meet the nutritional requirements and to prevent malnutrition. We are to maintain acceptable blood chemistries, blood pressure, and fluid status through the consumption of the prescribed diet, nutritional supplements, and also prescribed medications.